And now for our next presenter, Grace Duffy. Grace specializes in organizational and process improvement, leadership performance excellence, customer service, and teamwork with a strong focus on healthcare. She works internationally designing and implementing effective systems for business and management success. She is the author of the Quality Improvement Handbook and the Executive Guide, Improvement and Change, the Public Health Quality Improvement Handbook, Executive Focus, Your Life and Career, QFD and Lean Six Sigma applications for public health, Modular Kaizen, dealing with disruptions, applications and tools for creating and sustaining healthy teams, and the Public Health Quality Improvement Encyclopedia. Grace has over 15 years' experience working with healthcare organizations. Among these institutions are Roper Hospital, St. Francis Bon Secours, VA Medical Center, U.S. Health and Human Services, U.S. FDA, Cigna Healthcare, St. Francis Hospitals of Indiana and Illinois, the American Red Cross, and many others. Grace holds a master's in business administration from Georgia State University and a bachelor's in archaeology and anthropology from Brigham Young University. She is an ASQ Certified Manager of Quality and Organizational Excellence, Quality Improvement Associate, Quality Auditor, Six Sigma Green Belt, and an ASQ Fellow. Grace is a certified Lean Six Sigma Master Black Belt and a Manager of Process Improvement. And now, I present to you Grace Duffy.
Well, thank you, Rick. I appreciate the introduction. I'll be talking today about a healthcare industry looking at maximizing productivity improvement. One of the major things that we're finding today in the healthcare field is that we must be very, very flexible. The healthcare arena is huge, very, very complex. One size is never going to fit all. So what we've done at the Harrington Group is accumulate a number of colleagues who have extensive background in traditional healthcare environments, in public health and in community health, and in the kind of partners that we need now with the Affordable Care Act and some of the other regulations coming in the United States and also in the international marketplace. So we've been fortunate to accumulate several of us who have a lot of experience working specifically with healthcare organizations. Now, the goals of what we try to do in productivity improvement in healthcare are, well, there are several of them. Certainly, we want to improve organizations. We want to look at those operational outcomes. We want to look at maximizing the system performance of how you as leaders have put that together. We want to increase patient and customer satisfaction, certainly, but above that, we know we need to look at the cost of healthcare. We know those pressures are there, and what we want to do is positively impact the culture of healthcare, and we know that that is rapidly changing in a global environment, if not only the national one that we have here. So why is productivity improvement important in healthcare? Right now, people in healthcare, and this has been true all along, people in healthcare already come in with incredible intelligence. You are wonderfully educated. Healthcare is a very, very strong environment. So what we need to do is look at some innovative restructuring in the healthcare environment so that we can leverage the existing skills and capabilities that already exist in this complex environment. We need to look at supporting the basic concepts of continuous improvement, but there are going to be different approaches in healthcare. Most healthcare organizations, and certainly traditional hospitals, have the clinical side and certainly the administrative side. We also know that there are teaching hospitals, there are government-funded hospitals, there are for-profit, there are not-for-profit. So we really need to look at a combination of existing processes and also at the redesign of processes and new innovative offerings that we can help with to support the long-term goals and the sustainability of the healthcare organization. So what is the purpose of a productivity improvement model? What we want to do is come up with an infrastructure that will help or support what the healthcare organization has already done. Now, Dr. Harrington has published a great many books himself. Several of us in the healthcare background have published texts on our own or with Dr. Harrington to reinforce the use of the quality improvement and the business improvement techniques so that we can assist organizations, specifically in the healthcare environment, looking at the new regulations, looking at the new legislation, but also looking at individual communities with what we're trying to do or what your organization is trying to do, to integrate the tools and techniques of improvement and productivity with the existing requirements that you have at administrative and clinical and educational, as well as the new community benefit environment. So we've been working through some of that for several years now, and then we also have information so that we can share with you what we have found to the limit of confidentiality with our client base in comparing concepts and techniques. Certainly there are things that we can do with our background to be helpful to your organization. Now, one of the things that many of us have done, and here is simply an example of my own experience, when we talk about helping with a productivity or an improvement model, some organizations already have their processes in place. You already have used the Baldrige criteria, you've used Joint Commission, or you've used DNV, you've used some infrastructure, and you have a cultural and strategic base of your own. What we would want to do, and what we try to do with our clients, is to work with you to learn how you run the business, how you see your customer segments, and how you see your patient and client outcomes, so that we can help provide an ongoing structure. The slide you see here is a slide that we use as a graphic interface with a client I had the opportunity of working with several years ago. Now, we affectionately call this one the rocket ship model, but it really showed in the center of this particular graphic, in the tube in the middle, the customer experience, the patient experience, so that we can work not only with the rounding, the standardization, the sustainability of what you do as your organization, but also the crisis mode. When there has been a disruption, when we have had a seminal event, when we've had one of those never events, how do we recover from those? And what we need and what we try to share with our clients is how to anticipate as much as possible. This model shows the human element, the skills and capabilities and the capacities of what you and your personnel already bring to the arena. And then we come in and try and work with you, listen to how you choose to run the business. From there, then, we look at additional skills, additional organizations, additional design possibilities that are going to help you create and expand your existing customer experience. Then on the other end, we want to look at the measurements. How are you maintaining your sustainability? How are you maintaining your customer satisfaction? Are we looking at PRC and Press-Ganey data? Are we looking at Baldrige criteria? Have you used some of the other process improvement and productivity improvement models? How can we use them to leverage the existing excellence that you already have in your organization? Then we also look internally at the employees, internally at your own staff. Look at that corporate culture, that organizational culture. And then with what we're finding, the feedback coming back, and you can see the loops on the outside of this particular slide, we can see that the communication and the job aids at the top of the slide feed then into that customer experience, be it the internal customer, which would be your staff or the product, or the external customer, the patient, the family, the community, and the shareholders. So that we're looking at measures that give us the stability and the sustainability that we know that our clients need and that the health community is looking for in the full term. On the other hand, we also need feedback loops, and you can see that at the top of this chart, that will feed in the new influences coming from the external environment. What is the new legislation doing? What are we doing with changes in our demographics and changes in our communities? Now, what we've done at the Harrington Group is get several of us together with good healthcare experience and health background to look at a three-stage approach. Now, I use this particular slide because it works very well for me. Some of my colleagues have different approaches, and that's fine. We fit the consultant with the organization. That's what Rick does, who introduced these sessions. What I like to do is look first at where are the constraints in your business. You know what your outcomes are. You know how you need to run the business. I first use a concept called theory of constraints. What is keeping you from getting to the end outcome that you need? And I know it's not just one. The healthcare is a complex environment. Once we've understood what those bottlenecks are, and we want to get the flow going through the organization as effectively as possible, then we move into the next level, and we use the lean concepts of let's eliminate waste. Where are we using resources, be they capital, be they knowledge, be they data, be they human, whatever it is? Where are we using a resource that is not as productive as it might be? Now, I'm not suggesting that we just find this waste and cut headcount or cut budgets or do any of those things. What we want to do is look at the return on investment for any of your activities. That then is going to take these resources that you can roll back into your organization however you need to. If you're not for profit, you'll have one alternative. If you're a for-profit organization, you'll have another opportunity. If you're a government organization, even another solution. And we look at those activities. So what we want to do is reduce as much of the waste as possible, because then we really have that productivity. We really have the improvements going on in your organization the way you are comfortable in leading them. And then we use a term, and many of you probably have already heard, the concept of Six Sigma. How can we, and Six Sigma simply is a terminology, those of you may know total quality management, total improvement management that Dr. Harrington has already written about in a number of his texts, to reduce the variability of the standardized processes you already have. Now, certainly in the clinical processes, those are set through your medical industries. We're not going to go in and tell you how to run the ER, at least the procedures and the protocols, any differently. That needs to stay with your medical campus, your medical environment. However, the skills that we have is looking at all those different processes, procedures, protocols, whatever you're working with, to find the best way that they can work together to make sure that you are using your resources the most effective way possible to meet your probably changing goal spectrum with what you're trying to do in running your organization. Now, how do we then lean out healthcare? How do we help you do that? Now, for one thing, we're not going to come in with all the answers. We know we can't do that. You know what your business is. However, what we try to do is reduce any redundancy. Certainly, we want to reduce any waste, help you improve the quality of what you do. We have ages and years of experience in looking through different industries and a good bit of experience in healthcare as well, in looking at the skills that you already have, how your case managers are working, how your ward teams are working, how your different ERs and other areas are working, and finding ways to interact with those different processes so that they are as smooth as possible, flowing from the supply area of beginning with the process until you have delivered the particular outcome to whoever the customer or patient or family member community is with that particular process. We want to look not only within your organization, but at the supply chain as a whole. Where are you getting your materials? Where are you using them within your organization? Is it possible now that we have the community benefit requirement from the Affordable Care Act, is it possible to look at competitive advantage, where the specialties are within your particular professional community, and then find partnerships with areas in the community, be it a regional, be it your health system community, whatever, where we can overlap and leverage skills so that you aren't duplicating those kinds of skills when you don't need to, when you can leverage and use something else. And then we want to possibly look at some of the priorities that you have and see if there are some, if you're a little short on cash in one area, maybe we can move it to another. Certainly we would respect your financials and businesses. That's for you to do. We will work with your financial community. We might want to delay or suggest that you cancel some original plans or defer them because another priority has moved in front of that one. So we would have some tools to help with that prioritization. Now, there's some additional waste removal areas that you obviously know about already. Can we reduce overtime? Is there a way, using our productivity tools and techniques, that we can help an individual job definition be more productive, flow more smoothly, so that the individual with that level of responsibility can take that time and roll it into other things that are on their to-do list? None of us goes home absolutely bored because we haven't had enough to do today. What we look at is, how can all of us working together as a team use our skills and capabilities the best possible way, in the best connection of resources, processes, materials within the organization, that there is resource that can be rolled back into the organization, whether it be cash flow, whether it be the human knowledge transfer, whether it be better use of data analytics, better use of project management software. The Harrington Group has a number of these different areas that you will have the opportunity of looking at, where we can support you where you need that support or where you desire that support the most. Certainly we want to reduce length of stay. I'm doing work with an organization out of Northern Virginia right now, where we're looking at reducing and anticipating sepsis, reducing length of stay based upon the protocols that already exist in the hospital for sepsis. It's not that we're doing a whole lot new. We're going back and reminding our nurses, ER people, all the clinicians, what it is that we knew we needed to do to begin with. And that brings back the information, and we go back to the knitting. And it is returned so much in return on investment. We are not losing test results. We are getting test rates, lactates within the 60 minutes. We are doing the protocols that we need to do. We are anticipating when sepsis might be an issue. And this is reducing the length of stay significantly. And we are returning incredible amounts of cash flow back into the organization and recovered funding. Some of the things that we want to do in helping to reduce the waste, or just the additional information or activities that we have always done in the healthcare environment. What we want to do is look at each of the things that we do, now in priority. Certainly we don't want to go through everything, and we have tools that will help us to work with you on the high priority areas of the business and of what you're doing, certainly clinically and administratively, and then educationally as well if you're a curriculum-based teaching organization. What we want to do is reduce any of the waste and improve the quality and the flow of the particular processes you're looking at. The other thing is that there certainly are never events. We know that we want to reduce patient falls. We know that we need to make sure that infections are lowered. We know that we want to make sure that any erroneous operations, any disasters are anticipated and that they are minimized as much as possible. Certainly we have the skills and the tools to assist with that. We want to look at the supply chain of where are you getting the materials for your processes, where are you getting information from your suppliers, what information are you getting, where are you getting your data, and we have the skills and the technology to support you in the flow of information and materials into your healthcare environment. How to use those materials as effectively as possible and productively as possible, and to deliver the kinds of outcomes that you have promised to your community, to your stakeholders, to your patients, families, and your own physicians. So we want to look at that. And then there's also the possibility of delaying or canceling processes or commitments just to help balance the cash flows, to balance the return on investment of what you're doing with the resources that you have. There's some additional waste removal that we look at. Certainly what we've seen historically is a reduction in overtime, because we've been able to work with the individuals who are involved in the particular activities, because all of us know when we're working on a job, when something could be done more smoothly. We can work with your folks, with your administrative folks, with your executive group, with the board of directors. We can work with any level of the organization to look at processes, involve the right people in that study, and then remove anything that is unnecessary action so that everybody can get to what we have on our to-do list. all of us go home at night never getting as much done as we wanted to get done. It's not like we need to cut headcount. What we want to do is look at the return on investment for the resources that we're using. I've been working recently with an organization in Northern Virginia looking at sepsis actions, how we can anticipate sepsis, how we see it quickly when it comes in with a particular patient, or when it manifests on the ward or in the ER, and make sure that we go back to the protocols that are identified. It's not that we need to do something different. We need to make sure we do what has already been defined to support the sepsis, because the better we can treat it quickly, the lower the length of stay is in treating and in responding to a sepsis situation. So we're finding that there is incredible return on going back to what we know we needed to do in those sepsis treatments to begin with. And the return on investment is credible. We have been able to increase the headcount in the teams that have been working in these areas, because we are getting the length of stay down to the point, and the readmissions down to the point where we really can show by report that these activities are valuable and that we are gaining and rolling these lost resources back into the organization. We're also seeing that we're reducing some unnecessary testing and diagnostics. Now that ends up being an interesting balance, because even if we want to use physical therapy rather than diagnosing a number of CT scans or something, or suggesting CT scans, it might be that there's another reason why we need to use the equipment. So we have to listen and talk, and each of the situations is different. So we need to understand and work with the people who know those procedures well. So we work well with the teams. Also, we want to reduce any delays, error in billing. Another thing that I had the opportunity of working with an organization where we had groups of case managers and groups of diagnosticians who were coding in a way that they thought they were being helpful to the patient in not billing some activities. Well, what we found is that it wasn't like that money wasn't going anywhere, or that the Medicaid wasn't being billed for it, and it should have been. What we found was that if we coded it properly, the cash flows would have worked properly, and we just hadn't explained that to the people who were doing the coding and the people who were writing the bills. That is just simply a very specific example of some of the gains that the Harrington Group has come up with already in our work with clientele. Now this next quote is something that Dr. Harrington mentioned. He does a blog on the Harrington Group website, and he's wise. Dr. Harrington's been working for years and years, and I caught this one quote that I particularly enjoyed, because it reflects a lot of what the Harrington Group does in using Six Sigma as a process and productivity improvement model. There are really two approaches to productivity. Certainly we want to make sure that we have the cash flows to keep the organization open. We need to keep the doors open. We have to pay the bills. We have a payroll. You have incredible human beings, personnel, who work for you, who provide support to your organization. On the other hand, we also look at the customer satisfaction, the reputation of the organization, the needs that we have to respond to legislation, to the standards, to the requirements for customer satisfaction and stakeholder and community reputation. Now that the Affordable Care Act is talking about the community benefit piece that we now need to report. Six Sigma looks at two different ways. Now, Dr. Harrington calls this reaping the biggest harvest. In reducing the variation of how we work with our patients, how we work in the situations in the healthcare environment. Certainly we want to worry about cash flows, but we're working with human beings. We're working with communities. So Six Sigma gives us the opportunity of balancing those two ends of the continuum. Do we keep the doors open and worry about the cash flow, or do we spend a little extra time with that patient, the extra time with that stakeholder, the extra relationship building with the community? And there are tools and techniques that help us individually within the organizations to balance those needs, to look at the return on investment, not just financially, not only quantitatively, but qualitatively as well. And I really appreciated Dr. Harrington with his comments in bringing this up on his blog. Now, something else he brought out in the blog, and this is I call this the healthcare stages. Actually, Dr. Harrington called this graphic healthcare stages in his blog. There is a continuum of how we work with our patients, with our communities, with the populations in health and healthcare. There's certainly the traditional healthcare, which has historically been on the continuum of the chronic, the acute healthcare. We're looking at treatment options, and that's an area where most of us have spent a lot of our time in healthcare. Let's make sure that the ER is moving as smoothly as possible. Let's make sure that we have the ICU balanced as properly. Let's make sure that we have the staging areas as they come out of ICU so that they are waiting on gurneys in the hallways until we can get them into a bed. The standard things that we've done for a good many years. What we're seeing now, and where I'm getting more involved now as the Affordable Care Act comes in and talks about the Affordable Care Organization, is the other side of the continuum. The work that I and my colleagues have also done in public health and health departments and community services and assistance departments with some of our state, local, and federal organizations, we're looking at the healthy population, looking over to the left side of this particular slide, because we want to talk about prevention. We want now, especially since we're encouraged to have the community benefit, and health systems are going to be required to report on our involvement in community benefit, how can we use those resources to compare or to collaborate, I guess is a better word, with the traditional health care so that we have that continuum of care. Not only are we treating people coming into the ER, not only are we treating people in clinical situations, but we're anticipating lifestyle behavior issues where we have that transition. Say we have people who are at risk for diabetes. Let's talk more at lifestyle choices. Let's talk more about nutrition choices. Let's anticipate and work at those behavioral areas. And the health community is collaborating more. And so we have been involved as a group through the Harrington Group and as our own consulting backgrounds to share that information and use it with a number of clients. Now, how would we improve the health status of the community? Here are just 7 issues of what I have been involved in myself and what I talk with my colleagues on. Certainly, we need to assess community health. Now, the healthcare community, the Joint Commission, the DNV community, Press Ganey, PRC data, all those customer satisfaction vehicles that we already have been providing community assessments with us for some time. We have been involved in developing programs, in helping organizations expand programs, in pilot testing, in looking at expanding markets where community has changed so that we can support the organization. Here is just a fast graphic that shows the red building in the middle in this graphic can be the traditional health system. This can be the local hospital, working with volunteers, community organizations, not-for-profit organizations, knowledge transfer through the funding bodies, working with Robert Wood Johnson, working with the CDC, working with Kaiser, AstraZeneca, any number of organizations, to look at using resources as positively as possible, and then also getting involved on the community side. Faith-based organizations, the not-for-profits, the entrepreneurial, clinical and home health care organizations, so that there is a total community that can provide health care to the point not of competing with each other, but using our own competitive advantage. We also had a set of tools. Now, I won't take you through all of these. However, the Harrington Group has information specifically. The Six Sigma process uses a 5-step approach. We use the basic tools of quality generally because mostly healthcare systems, you are intelligent, you are well organized, you have the tools already. What we do is look at helping you to define the situation and then measuring the current state so that you can define and analyze using the tools of quality, using the tools of business process management and design to identify and graphically illustrate potential solutions to the challenges that you have. Then we support your organization if you choose to have us help implement those solutions. And then at the end, control, set up measurement and monitoring, the feedback loop that allows you to sustain those changes and further some of your information. Now, we can use that with the basic tools of quality. We also can look at some advanced tools, because certainly in a healthcare system, it is so complex that we have to look at the strategic approach and use some more advanced tools. We still use the same 5 define, measure, analyze, improve, and control steps, but we use more qualitative, brainstorming, looking at SWOT, which is strengths, weaknesses of the organization, opportunities and threats coming from outside the organization, working with your executive team, with your board of directors, with your community leadership team to find ways to anticipate the kinds of challenges and risks that are coming down the pipe. So we have a number of tools that can help you with that situation. So there are things that we want to work with, things that we have the background to share that we would love to work with you on. I'm going to go through the last 4 slides again. What can we do to improve our health status within the community? The Affordable Care Act has now encouraged us, to be subtle, to improve the health status of our community, and how can we be productive in doing that? One of the things that the Harrington Group has done for a long time is to help communities, whether they be organizational communities, whether they be geographical communities, help to assess the current situation. There are some wonderful tools that are available in assessing community needs, community health assessments, community health vehicles. We can certainly help in that area, and then to work with you and your organization to develop programs, maybe expand existing programs that you've already started, to pilot test some that you have been thinking about. Certainly evaluating programs is one of our fortes. There's something else that the Harrington Group has done for a good many years. Harrington Software, which is a subset of the Harrington Group, has phenomenal technical support in programming. So as you look at data analytics, as you look at the data that you already have in customer support, as you look at your personnel, employee satisfaction surveys, those sorts of things, we can help look at that information and in general help you identify further expansion possibilities to your market, maybe areas where you can expand morale approaches, maybe teamwork avenues within your organization. So there are things that we can do and have done with organizations that I wanted to point out. Now, one of the things that I've gotten involved with recently, and fortunately the Harrington Group is quite aware of the need for this opportunity, is the Affordable Care Organization. Now there are registered affordable care organizations or certified organizations around the country. And what we're trying to do is looking at the productivity of the flow of processes in balancing the resources among the different components of that affordable care organization. Here is simply just a graphic that shows what looks like the traditional brick schoolhouse right in the middle of this particular graphic. That very well could represent the hospital system, the traditional hospital campus that you have. That campus now has encouragement to spread out, to work with external sources, the local community. I've been involved with, as CEO of an executive community of excellence, and we would work with the CEOs of the major organizations in a community to find ways to share knowledge between and among our healthcare population, the community, the employees' families, the different organizations that supported all of those families, the entrepreneurs, the business community, so that we had knowledge transfer, we had funding, collaborations, and partnerships, so that we understood a total return on investment for where the skills lie in the community to meet that community's needs for health and for health care. And then on the other side of this particular chart, we see suppliers and partners, not-for-profit groups. I've worked with faith-based organizations, general communities, so that there are a number of volunteers, be it professional societies, be it activities within the organization or outside where they are partnership and internship type relationships, so that we can look at matching funding, we can look at health assessments from particular subsets of our population. So there's a new impetus now where we can gather and support these community relationships. And finally, there are really two approaches that we can have for productivity. There are a set of tools that we have available to us in the quality and the business improvement organization or the business improvement community that we use, and this comes back to the Six Sigma role that I talked about earlier. Six Sigma generally uses a 5-step process for productivity and performance improvement. We define the environment, and this chart shows a series of tools and steps related to those 5. Define, measure, analyze, improve, and control, and you'll see it split out here in this particular chart. Now, what we want to do is, as much as possible, keep it simple. We want to use the knowledge that already exists within the organization with simple, just-in-time knowledge and use of these tools, so that nurse teams, floor teams, clinical teams, administrative teams, work teams, whatever, can use these tools to get done better what we do every day. This particular chart, this slide, shows the basic tools of quality, how we can brainstorm ideas, how we can look at the effects of issues and find ways to reduce the barriers and forces that keep us from getting work done as quickly as possible. Let's look at the as-is state, and we'll find a series of tools where we may use something like the 5 whys technique, where we continually ask, why did something happen, until we roll back to the real root cause of what that issue was. How we can use different tools to graphically illustrate the potential solutions. Look at pie charts and histograms and control charts, scatter plots that many of us have learned in our graduate statistics courses. How we can look at solutions, how we can choose the right solution that will fit the particular need that you have in your organization. And then how we can transition and update the documentation, make sure that we're aligned with the requirements, the standards, the protocols that we know we have to follow in our healthcare environment, so that long-term sustainability is something that we know that we can track and monitor and manage until we come into the next challenge. And it is a cycle of what you're seeing in this particular slide. Now, some of these activities are even more complex. There is also a set of tools that we learn as Harrington Lean Six Sigma Master Black Belts to work more with the executives, work with the board of directors, work with the senior executives in your organization and the senior executive leadership within your community, so that we are looking strategically at the long-term viability of your organization. Where do you need to go in the future? Where do we think legislation is going in the future? Where is our financial environment going? How can we look at the long-term return on investment for the decisions that you are making? What are the choices that we have? There are a number of more advanced tools that we work with. Still use that 5-step define, measure, analyze, improve, and control. There are some additional innovative tools that we have that I won't cover right now. However, we look at interrelationships. The interrelationship diagram helps us to look at different stakeholders, something we did in Chicago as they were looking at hosting the Olympics several years ago between government and business within the geography. How can different parts of the organization or parts of the Chicago land work to understand the best way to use each other's resources for visibility, to show how excellent that community is? How do we work with it? How can we look at SWOT analysis, strengths, weaknesses of the organization, opportunities and strengths? Let's look at the control and influence that we have as an organization. I'm just going through some of the different tools that are on this chart. Many of you have project management skills. We will use the flow of project and change management to get the organization where you as senior leadership wants that organization to go. Then we'll certainly look at priorities, because they are changing so rapidly now as our environment, financial and economic, and also as reputations change, as our public opinion changes, how we can work at problem priorities in working to monitor then your excellence and your strategic approach over time. So there are a number of tools that we have available to us that are fine-tuned and closely tuned to the needs of the particular organization. What we'll do over time is work with you as an organization. You have heard other of my colleagues speak today. You have heard other colleagues and information from the Harrington Group on what is available to us. I hope that this has been helpful to you, and certainly we will continue to provide additional tools and techniques and support available to our client organizations in the future. Thank you very much.
Excellent, Grace. What a presentation on maximizing productivity in the healthcare industry. I'm sure everybody got some great knowledge out of that. And now, for our next speaker,